So I get the pleasure of introducing our last speaker tonight. This is Dr. Randi Hagerman, spelled R-A-N-D-I. I've been working with Randi now for 20 years, and I've had the pleasure of traveling all over the world with Randi, as well as all over the United States. She is the world's foremost expert on something called Fragile X syndrome, which is the most common known genetic cause of autism. I'm sure she'll be talking about that. She is the kind of, if you're going to have you have a child with special needs and you want a doctor like Dr. Hagerman who actually listens and is able to bring all of the best evidence-based interventions to the child's treatment. So, Randi, we've been talking a lot about cultural issues here tonight, and about being culturally sensitive and to the culture that you're working in or with. That's been one of the major themes of tonight, and I know you've traveled, we've traveled all over the world together, but you've been to even more countries than I have. And have learned that lesson probably numerous times. But I know Dr. Hagerman is going to talk with you here about autism and other neurodevelopmental disorders. What's the state of the art when it comes to intervention and treatment? This is the person, Dr. Hagerman is the medical director of the UC Davis Mind Institute. Randi, come on up.
So it's a pleasure to be here tonight, and I was asked to talk about what is autism and other neurodevelopmental disorders. So this discussion can go in many different directions if you want. So I'm sorry I'm a little late tonight, but we had a speaker at the Mind Institute, Stacy Bilbao she's from Harvard, and she was talking about looking at environmental toxins combined with maternal stress and how that can lead to autism in animal models. So first off, autism or autism spectrum disorder is what the new name is a behavioral disorder that's defined behaviorally. You have to have social and language communication deficits combined with repetitive behaviors. Sometimes they can be hand flapping or stereotypic behaviors or even repetitive or perseverative speech to meet the diagnostic criteria for autism. But because it's a behavioral descriptor, there are multiple different etiologies for autism. So we know that about 40% of individuals with autism will be positive on at least one of the genetic tests that are done. I'm very interested in those that have Fragile X syndrome, and there's a Fragile X DNA test that you can even do on a blood spot or on a blood sample and find a mutation in the Fragile X gene. However, there's about probably well more than 400 genes that when mutated can cause autism. And the reason why there's so many genes is because any process or gene mutation that interferes with the development of synaptic connections or how the cells migrate in the brain or how impulses are transferred from one neuron to the other can lead to autism. So there's really hundreds of genes that can cause autism when they're mutated. And so that's why the genetic test is critically important. However, we now know that it may be more than one genetic hit or a genetic problem combined with an environmental problem. For instance, we know that kids who live closest to where they are spraying insecticides in the field have a much higher rate of autism than those that don't get exposed to insecticides or pesticides. So we know that that's a very important toxin. We now think that also pollution, like smog and diesel fumes. In fact, the person who was talking at the Mind Institute today was talking about how animals exposed to diesel fumes during their life, combined with the mother being stressed, can lead to autism. So you can have a genetic vulnerability combined with exposure to an environmental toxins, and things like even alcohol, like fetal alcohol syndrome. A certain percentage of those kids can have autism also, probably about 10%. We also know that there can be changes that occur to the genome, and these are called epigenetic changes. So there's no change in how the DNA genes are sequenced, but a change in what we call the methylation pattern or the epigenetic pattern that can change gene expression. And we think that that's how stress, like maternal stress, influences the genes that the mother is giving to the child. We also know that other things like the age of the father. The older the father is, the more likely there is going to be a genetic mutation in the sperm. And so having an aged father of a child can lead to autism because that's more likely to cause a genetic mutation. And also we know that kids that are born prematurely and go through the intensive care unit where they may have breathing problems or what we call hyaline membrane disease or different kinds of illnesses in the newborn period, or even a bleed in their brain, that can lead to autism too. So about anything bad that can happen to the brain can sometimes result in autism. So there are many, many causes, and now we're learning more about the combinations of problems that can add insult to injury that can lead to autism. And so it's very important when we're evaluating a child with autism to do a very detailed medical history. What were the medications that the mother took during her pregnancy, whether she delivered prematurely. Those that are delivered by C-section are likely to have a higher rate of autism than those who are delivered vaginally. And if you're born prematurely, that can really disrupt brain development to a certain extent and lead to problems associated with autism. Like if you're born very prematurely, the rate of autism goes up about 8 times. If you're less than, say, 28 weeks or 27 weeks gestation. So it is amazing how many different things can cause autism. Now, sometimes in the medical history, we learn about trauma or stress that the mother has had or the infant has had, or a period of time in the newborn nursery, or other problems that could lead to some brain damage. We also learn about the family history. So if there is a second child in this family that has autism, then the chance that the sibling will have autism is about 20%, okay? Because there may be a specific gene combination of mutations that led to autism in the first child, so there's a higher risk of this leading to autism in the second child. And so when we study families that have had at least one child with autism, we want to do intervention very early on for the second child that we're concerned that may have autism. So it's important to go through a detailed medical assessment. Sometimes kids can just look shy or be socially anxious, or what we call selectively mute, like not talking in certain circumstances, but talking in other circumstances that can look a little bit like autism but aren't really autism. So it's important to have a detailed medical assessment, and that medical assessment does need to include genetic testing, looking for a variety of gene mutations. The first thing we test for is the Fragile X mutation. Then we do what's called microarray testing, looking at little bits of DNA. Then we do whole exome sequencing, looking at all of the genes in the genome. And then we can do, if that's negative, then we can do whole genome sequencing, not only looking at the genes themselves, but all this in-between genetic material that can control how the genes express themselves. And sometimes we only find a mutation, like even a point mutation, a small mutation, say in the in-between materials, affecting a gene that's very, very important for, say, synaptic connections, how two nerve cells talk to each other. So each of these genetic tests is done in stages because each test is more and more expensive, but often insurance can cover it. We also have our genetics section at the Mind Institute sometimes has different grants that can cover some of this genetic testing. So there are ways to get the genetic testing if your insurance, doesn't cover it. But we feel that all individuals that have a diagnosis of autism need this genetic workup in addition to a medical workup that can look at, exposures and other sorts of problems that have happened during the child's development. The other thing we know is there are new treatments that can really help individuals with autism. I do a lot of research about treatments that can help individuals with Fragile X syndrome, but sometimes the medication that seems to be helpful in Fragile X can also help other causes of autism. We are looking at a targeted treatment now called metformin, which individuals take when they have type 2 diabetes, but actually metformin can reverse the neurobiological abnormalities seen in individuals with Fragile X syndrome. We're also doing a study about CBD, cannabidiol. Who knows what CBD is? Okay, so CBD or cannabidiol is the non-psychotropic component in marijuana. And actually you can get preparations that are pure CBD, have very little of the psychotropic THC, which is what makes you high in marijuana. So CBD can be very helpful for seizures, okay, because it stimulates the GABA system or the inhibitory system. So sometimes when anticonvulsants don't work very well, the family will add CBD, and sometimes that makes the seizures go away. But CBD can also calm down behavior. It can help with tantrum behavior and aggression and hyperactivity. And some individuals with autism can have these additional problems like hyperactivity or seizures or aggression, particularly towards moms, because moms are the most comfortable person they're with. And so if they feel very aggressive and want to hit somebody, they're much more likely to hit the moms than they are to hit the dads. Dads don't tolerate very well aggression towards them. So sometimes kids that have major problems with aggression, there's a lot of other medications that we use, but CBD can be a treatment that may help a lot with aggression or tantrum behavior, etc. So we're testing out a lot of different medications at the Mind Institute. And so if you have a child or know somebody with a child with autism, you can get a good evaluation at the Mind Institute. Your regular doctor just needs to refer to the Mind Institute, and that's an easy number. It's 1-800-4 The number 4, UC Davis, and just to refer to the Mind Institute. And then if your child, there's testing that we do to look and see if your child does have autism. And if the child does have autism, there's a variety of different research programs and a variety of different genetic testing and medical assessments that are done. So there's treatment programs not only with medication, but also treatment programs to stimulate language, to reduce anxiety, to help, like the Early Start Denver model has really been a great ABA type of research, a behavioral intervention for young children with autism. And Sally Rogers and Sally Osnoff and Aben Stamer at our center have been proponents of the Early Start Denver model. So we have many psychologists there at the Mind Institute, and many doctors that evaluate children for autism. A really interesting form of autism is called MIA. It's a maternal immune activation problem that may happen in as high as 20% of women who have children with autism, where the mother produces an antibody during pregnancy that cross-reacts with the brain of the fetus and reacts with different parts of the brain of the fetus. And so Judy Vandewater is someone who has evaluated, what antibodies that some mothers can produce that can cross-react to the brain of the fetus with autism. And so she's done a lot of research in animal models also to look at that. And then we have toxicologists that are looking at pesticides, insecticides, and even do studies of mice that are exposed to pollution every day. The cage of the mice is put over the Calicut Tunnel going into Oakland and Berkeley, and finding that those mothers that are exposed to the smog and the pollution from the cars are much more likely to have pups with behavioral problems and autistic features in the baby mice. So that fits with what the person was talking about at the Mind today, and she studies diesel exhaust and how that can lead to autism combined with the mother's stress. So I'm here to answer any questions or thoughts that you have about the cause of these kinds of problems. In the Middle East, and I know some of you are from the Middle East, and in the Middle East there's oftentimes what we call autosomal recessive conditions, particularly if you marry a relative like a cousin, and your cousin and you hold the same genetic mutation that's recessive. When those two get together, then you're more likely to have a child related to mutations that are autosomal recessive. And that we see commonly, particularly in countries where there's a high level of consanguinity, where your marriages could be to a relative, because they would have the same recessive genetic mutations that you have. So we see a lot of recessive conditions, and we hope to study that more too, or collaborate with people in different parts of the world that study recessive conditions. So I'm ready to answer any questions that you have. Yeah?
Is there any prevention?
Well,
Repeat the question, please.
is there any prevention for autism? Well, we think that exposures to toxins are bad. And so if you think of all the toxins in your environment, if you eat organic foods, you can avoid pesticides and insecticides. I would not have my house fumigated while you're pregnant. I would not breathe anything that is toxic or smells bad. Don't paint your house at the same time when you're pregnant. You have to be very careful when you're pregnant to stay away from toxins that could impact the fetus. If you know there's a genetic mutation in the family and that you might be a carrier, for instance, if you're a carrier of Fragile X, you can prevent having a Fragile X fetus. You can do it in many ways. You could become pregnant and have a very early prenatal diagnostic test to see if the fetus carries Fragile X syndrome or the full mutation. Or you could have in vitro fertilization, where they fertilize your normal eggs. So they would take the eggs that don't have the genetic mutation and fertilize them in vitro, outside of your womb, and then implant the normal embryos. So that's how Fragile X carriers can avoid having a child with Fragile X syndrome. So these new reproductive techniques, a woman has the choice. If she has a prenatal diagnostic test, she can decide to terminate a pregnancy where there's a male fetus affected with Fragile X syndrome, and you can do that very early on, practically before anybody knows you're pregnant, very early on in embryonic development. Or you could have egg donation, someone donating an egg that's fertilized, in vitro and then implanted, so you know that the donated egg does not have the mutation. So there's a variety of reproductive techniques to prevent that.
Ronnie,
Yes?
would you say something about immunizations and autism, please?
Yes, so immunizations don't cause autism, so it's okay to immunize your children, okay? Although if you don't immunize your child and they get measles and go into a coma with measles, they're likely to turn out to have autism. So in a sense, immunizations can prevent much more severe illnesses.
They don't cause autism.
Yeah, immunizations don't cause autism. And what I'm saying, if you immunize your child, then they will not have any of these severe illnesses. Like someone in my family years ago died of diphtheria, before they had, the DPT that protected you against diphtheria infections. So, it's important to get immunizations. If you're at high risk or have your child diagnosed early on with autism, then very intensive early intervention, like with the Early Start Denver model, this is very intensive behavioral intervention, can actually dramatically improve about a third of kids with autism so that they leave autism behind. And then a third get a lot better but still have a mild form of autism. And then a third, can have a pretty severe form of autism. And it depends if there's, a genetic cause of autism mixed in, with some of the maybe environmental causes of autism. So we also recommend, eating organic. And also we recommend antioxidants, because every child with autism or other neurodevelopmental disorders, they have oxidative stress. And that interferes with the best functioning of the neuron. So being on antioxidants, green tea, omega-3s, curcumin, that's often, in India and other cultures, they do a lot of cooking with curcumin, and that's very good. That's a very good antioxidant. Resveratrol is another antioxidant. There's a variety of antioxidants that are very good. So we think that can be helpful too. But most of my research is done on, targeted treatments that hopefully can reverse, some of the cognitive and neurobiological problems that these children experience. And the majority of kids with Fragile X syndrome have autism, and it's the most common genetic cause of autism. So the genetic testing is really important to get you into different treatment programs. Rett syndrome is another very severe neurodevelopmental disorder where it affects mostly girls because the boys with this mutation die very early on or in utero, and the girls can look okay in the first year or two, but then they can go downhill, lose language, and do a lot of hand kind of ringing. And we're going to try a new treatment called Anavex 2-73 in children with Rett syndrome, and because it dramatically helps the mouse model of Rett syndrome. So all of these treatments have come about because there are animal models for many of the genetic causes of autism, and you can test all these treatments out on the animal to see what cures the animal, and then if it's safe for humans, then you can start in human trials. And that's why there's so many new targeted treatments now for a variety of neurodevelopmental disorders. Yes?
Dr. Hagerman, would you give more definition about the CBD, that the kind that you're using from various pharmaceutical and testing in mind? And so is it exact marijuana, or is it a kind of combined medications that they can do?
Yeah, so we are doing a study of a pure CBD preparation made by a company called Zenurba. And this is a CBD ointment that you rub on the shoulders twice a day in the child. And it has up to 100 milligrams and 150 milligrams actually of CBD. And we're doing a controlled trial. So we're comparing a CBD ointment that's pure CBD. There's no psychotropic elements. There's no THC. And it's not on the market yet. They're trying to get it through the FDA so they can get it on the market, because it is very hard to get a pure CBD preparation at a marijuana store. Okay? The marijuana stores have a variety of CBDs, you know. They have, some plants are raised to have a much higher rate of CBD compared to THC, but when you are generating it from a plant, it's hard to get rid of the THC part. And so most of what you get at marijuana stores are mixtures. They usually say, 10 to 1 or 20 to 1 CBD to THC. So there's edibles, there's cookies, there's tinctures that you can drop in the mouth, there's sprays, besides, different preparations that you can smoke or vape. So we don't like the smoking because that causes oxidative stress. Just the smoking itself can cause oxidative stress. So we like the edibles more. You can also make CBD preparations out of hemp, not the marijuana plant, but hemp. And the Charlotte's website makes CBD from hemp. So Charlotte's website was started using CBD as an anticonvulsant to help with seizures. There is only one preparation on the market that's pure CBD now, and that's called Epidiolex. It's made by GW Pharmacy, and they got FDA approval to treat intractable seizure disorders, and also Dravet, which is a different genetic mutation. And they have very bad seizures. So the problem is most doctors will not prescribe, they can't prescribe CBD unless there's intractable seizures or Dravet syndrome. So Epidiolex is really not very available for just the average child with autism, particularly if there's no seizures. But Zenurba manufactures it, so it doesn't get it from the plant, but it's produced, it's manufactured, and that is a product that hopefully will get through the FDA after the study that we're doing now. It's taking place at multiple centers in the U.S. and also in Australia. So they really hope to get it through the FDA so that this CBD ointment that's pure CBD will be available to rub on the skin. Because a lot of kids with autism have a hard time taking medications that are pills. It's hard for them to swallow pills, so you sometimes have to crush it or give them liquids.
Lonnie, I know you've already said this, but I think it's worth emphasizing that CBD does not make you high. Not
Yes.
making the children high.
So CBD does not make you high, but it helps with anxiety, sleep disturbances, and chronic pain. It's a good painkiller too. But it's good for the brain because it stimulates the making of new neurons. So it has some very healthful features.
What was the company that was making pure CBD?
So Zynerba makes, Zynerba, makes the preparation that we're studying now at the Mind Institute. And their study is called Connect Fragile X, or FX. And then Epidiolex is made by GW Pharmacy. So that's a different pharmacy company. And I think Epidiolex would also help with behavior, but that's not what they got it through the FDA for, and it's very constrained in who you can prescribe it for. Yeah.
You said that C-section can cause autism.
Well, so C-section, having a C-section is has a higher risk of autism, I should say. So your risk for autism, I think, is increased 2 times, I think, with a C-section. So this is found from studies, okay, of large number of people and looking at who has autism. So it may be more related to what led up to the C-section. There might have been difficulty with the birth, or there might have been some hypoxic changes in the child that made the doctors want to do an emergency C-section to get the baby out so that the baby would have enough oxygen. But there is an association with C-section, just like there's an association with an older father. It's not that being an old father will always cause autism. That's not the case. But it does increase the risk for autism about 2 or 3 times to have mutations in the sperm of a male who's older.
I'm asking because in Iran recently, it's people want to do C-section, even it's not necessarily medical.
Yeah, that's not a good idea. It's much better to deliver naturally. I think some mothers, that might be afraid of delivering vaginally, think that a C-section is less painful, but actually it's more problematic. You're sore with a C-section. Yeah.
You use the word association instead of correlation. Is that
It just means there's a significant correlation or a significant association.
maybe that was intentional?
No, I mean, correlation, a significant correlation, makes you think of p-values and stuff, and it's really an association where there's a higher risk of autism if you have these certain conditions. Like, for instance, maternal obesity increases your risk for autism in the child, and also the mother having type 2 diabetes. That's associated with a higher risk for autism in the child. So maternal obesity, high blood pressure in the mother has some fetal effects too. And if the mother has eclampsia or preeclampsia, that can increase the risk for autism too. So all of these different things, that's what we look for in the medical history. We also look for exposures, like living in certain places, like living in Mexico City is like enough oxidative stress to be similar to smoking 8 cigarettes a day or something. So places where there's a lot of pollution, and I think Tehran has a lot of pollution. That might be similar to 5 cigarettes a day, and I've been in traffic jams in Tehran.
The amount of pollution, it's compared to the 10 cigarettes.
Yeah, 10 cigarettes. Okay, it's up in the 10 cigarette category. Yeah. Yeah.
Is there something that can cause the somebody with autism to get even worse? Is there things?
Sure, seizures.
No, I mean their condition getting worse than it already is.
Yeah, seizures, any kind of medical problems, hypoxic damage, sleep apnea without having that treated.
What is hypoxia? Will you define that?
Hypoxia is when you have a low amount of oxygen. And a lot of people who don't realize they have sleep apnea have low oxygen at night. And that's very bad for aging healthfully, but sleep apnea can occur in childhood. So trauma, major stress for the child, being in a traumatic situation or, severe discipline for the child can just really escalate anxiety and overwhelm the child. That definitely can make autism worse.
And the CBD, it doesn't have an addiction, right?
No, CBD is not addicting.
And we cannot get it through a doctor, right? We have to buy it.
Yeah, you get it through a marijuana store or via the internet. And I do recommend, Charlotte's website, because they make CBD from hemp, so it has much less THC in it. But yeah, through a marijuana store. But eventually, like if Zenurba gets on the market, their CBD ointment, then that will be available through prescription, and hopefully in the next year or so, that will be available by prescription.
Question, I think, right here.
Yes.
Is there any medicine for Asperger, especially for teenagers?
Yeah. So Asperger used to be on the autism spectrum. When they came out with the DSM-5, they kind of eliminated Asperger's, but a lot of people still consider that. So in Asperger's, you have to have normal language development, but most individuals with typical Asperger's have social deficits, and they oftentimes can speak in a monotone voice. They have intense interest areas where they can be experts in their intense interest areas. I've even seen Asperger people become, professors in an area that they're intensely interested in. So usually Asperger syndrome patients have normal or gifted IQs, but not always, but they have to have normal language development to be diagnosed with Asperger syndrome. And so anxiety can be a problem for those with Asperger syndrome and also those with autism spectrum disorders, and also for individuals with Fragile X and many of the genetic causes of ASD. So usually we're treating anxiety, and that can oftentimes help them have, like treating with what we call an SSRI, which means a selective serotonin reuptake inhibitor. It allows more serotonin to stay in the synapse, and that decreases anxiety, treats depression, but it also treats obsessive compulsive behavior. So many individuals with Asperger syndrome have obsessive compulsive behavior, like they might be obsessively interested, say, in sports or sprinklers or something weird, It might not be a sport team, but depression is a big problem long-term in, adolescents and adults with Asperger, because sometimes they're not able to make enough friends. And if you don't have friends, then you can get depressed. So the SSRI, I think, is one of the best treatments for Asperger.
Dr. Hagerman, besides that, I really thank you for taking the time and being here. But since your talk is getting recorded, and many would later on benefit from your information. Would you tell us that how important the Mind Institute studies, recent studies or ongoing studies, have affected the improving of agricultural pesticide in the valley and in Northern California or in general? Because many people don't know that the studies that Mind Institute does, it's improving their lifestyle. So since I read this in a very good article in the magazine, I'd like you to just bring it up, that how effective Mind Institute is on improving the pesticides on the valley.
So we have great researchers at the Mind Institute, and also the Mind Institute is linked up to a center at UC Davis that studies environmental toxicology, environmental health. And so researchers like Irva Hertz-Picciotto and Isaac Pessa and Pam Lyon, these are all researchers who study the effects of toxins. Pesticides, insecticides, there's been a big fight about chlorpyrifos and other bad toxins in the environment. And they've really showed the environmental toxicity in animal models, how it can be associated with autism and other neurodevelopmental problems. And they testified at the state legislature, to ban certain very bad chemicals in our environment. So we really appreciate these researchers. And they've started a program and international awareness about, the toxins that are in our environment and how to avoid these toxins. Mind Institute does research on so many things, not only pesticides, insecticides, but also now pollution with the mouse studies that are staying in a polluted area in California. And so hopefully this will lead to new legislation. I mean, we're very interested in, becoming all electric cars in California to avoid the pollution. That would be great. But the Mind Institute does a lot about behavioral interventions, language interventions. We're very interested in things like computer programs, like the CogMed program, to help with attention and focus. We have a big group that works on ADHD, or attention deficit hyperactivity disorder, and certain genetic conditions that predispose to schizophrenia, like 22q deletion syndrome, where many individuals, as they age, they develop psychosis. So we're very interested in many sorts of neurodevelopmental disorders, in addition to the disorders that are under the umbrella of autism, including Fragile X syndrome. We even do work on aging, because many of the carriers of Fragile X develop a neurodegenerative disorder called the Fragile X associated tremor ataxia syndrome, or FXTAS. So we're trying to find treatments that can reverse neurodegeneration with age. And we're very happy to partner with Census Cultural. This is Tata's foundation, which does a lot, so much educational endeavors and bringing teams to Iran and collaborating internationally and putting on many programs. So Tata, has, particularly the families from the Middle East and Iran, in her heart to try to improve, treatments for the mothers and the families and the children.
Thank you so much.
Yeah, it's my pleasure to work with Tata. She always has great ideas.
Too many ideas.
Yeah,
Great
that's
food when
okay.
you go to her house.
Yeah. So we're very lucky to be collaborating with Tata. and census cultural. Okay, do you have other speakers
Well, I'm
here?
just going to say a thing, and then Tata's going to come up and make some
Okay.
closing remarks.
Okay,
Yeah.
good, Robbie.
Yep. Okay, before Tata comes up and makes closing remarks, just want to summarize again. So we've talked about some interesting topics here tonight, all things that Census Cultural is very interested in, and that Census Cultural is working hard to elevate and make us all aware of. Refugee issues and trauma and autism and disability and all those things that all come together to challenge families to raise children that are happy and healthy. So Census Cultural is really paying attention to those issues, particularly as they pertain to the Middle Eastern community, both here locally and around the world. So Tata, it is a pleasure to be part of Census Cultural, and if you want to come on up and say a few closing remarks, that would be great.
Well, I just needed to thank the Zoroastrian Society and Association, my dear friends, Manije Behziz, Mrs. Afshar, if I'm right. Sometimes last names are mixed up. And particularly the Mind Institute professionals who gave me the hand to be able to transfer the knowledge about neurodevelopmental disorders and autism to Iran, and recently connecting to Germany, doing a lot of research together, and hopefully informing the community for the upcoming stem cell conference on 2020 as a solution and future possibility of treatment of autism. I just want to thank the Zoroastrian associations and thank the professors, the colleagues, the friends who gave me hand, and all people who are helping me. And I am the least professional one among many professionals who are giving me help. My grant writers, Robert Miller, especially her advice and counseling, and all of the good friends. I am blessed with bringing something good to the community here and community of my hometown. And hopefully this is going to be what it will last after us. But I am very thankful for the support I'm getting from the community, and I hope the information we are recording through our professionals, video men and cameramen, will transfer to many, many people, even though it's hard to bring everyone together. But thanks to internet, our website, and the good amount of work we do to transfer this information around the world. And we are blessed with the good hand that Professor Randy Hagerman gave me, and it really brings up our organization to the level that we are proud of what we are doing for humanity. And hopefully we all together will bring change to the world in whatever way we can. But God bless all of you, and thank you so much for the associations and everybody who gave me a hand tonight. Thanks.